A frequent and an important question from parents is what amount of worrying and what kinds of worrying are typical for children. It is typical to observe temperamental differences in a child's first weeks and months of life. For example, on a continuum we call reactivity, we have some children who are highly reactive to strangers and to noises, reactive to changes. On the other end of the continuum are the babies who don't raise an eyebrow in reaction to those things. It's our job to parent and to school our highly reactive children so they learn to cope with the potential liabilities of being sensitive, and for the adults to appreciate the strengths of our sensitive children as they become exceptionally compassionate and generous people. For the low reactive and often fearless children, our task is to have them learn a safe level of caution or worry. When we simply tell a child that it's wrong to feel what they feel and to stop feeling that way, they may learn to not trust themselves in ways that we don't intend. In several of his published writings, which I highly recommend, the physician Daniel Siegel discusses more useful strategies, including name it to tame it. In our daily interactions with our children and in our social and emotional learning programs for all students in the schools, we can provide children with the emotional literacy they need to describe their reactions and to learn how their thoughts, calm thoughts and worry thoughts, generate feelings and behaviors. Our school-age children will become increasingly concerned about fitting in socially and being successful in areas we measure, such as academics. When should we be concerned that the level of anxiety that is being experienced needs additional attention? I'd like to know more about the thinking inside the worry. Is she overestimating the possibility of the threat? If he is thinking he might perform poorly on a test, does he believe that one low test score will lead to failing the class? Does this 8th grader believe that her less than perfect performance on one test will determine if she can attend college? How intense is his worry? How automatically did her worry develop? And what was the trigger for her worry? I'd like to know more about his self-confidence in coping with the situation he's imagining. If Josette does not want to be his date for the homecoming dance, will he find someone else? Or will he decide that he'll never be happy or accepted? What do we know about the child's physical response to worry? Is she going 0 to 60 in 5 seconds from calm to fight or flight? Sweating, stomach aches, headaches, racing heart? Is he avoiding participation socially or academically? Did she stop doing things she used to do? Is he now clingy? Is she having frequent meltdowns? When you see avoidance and/or these physical and intense responses, it's really important to remember 2 things. Anxiety is treatable. 2, a child experiencing significant levels of anxiety may not get better without effective support. There are a variety of evidence-based treatment options. If you are concerned, it would be a good first step to discuss your child's needs with counselors, psychologists, and physicians. It might be helpful to begin by talking with a specialist in your child's school. In general, a highly effective treatment for anxiety works to change thinking regarding worries that are not rational or helpful. And as you change your thinking, your feelings and your behaviors follow from your current thoughts.